Hey, this is Jamon White. I'm with Paula White. We're founders of Four Oaks Medicare Planning. This is our podcast, Medicare GPS, navigating you step by step through your Medicare journey. So what do we have on the podcast today?
Yeah, so we're going to be talking about why doctors hate Medicare Advantage and why some people love Medicare Advantage and why the two do not meet typically. So we're going to go over that. We'll have our story time followed by a quote of the day and then end up with our news and deadlines.
Well, sounds good. Well, if you like this content, just make sure and like and subscribe. It just helps us be able to bring more content to you. And so let's get started.
So let's start off with just what is a Medicare Advantage plan? People hear about it. It's Part C. What is that and how is that different than the other Medicare things out there?
So if you remember, when you go on to original Medicare, Part A and Part B,
From the government,
you have out-of-pocket costs, and it doesn't cover everything. And so really people choose between one of two options. You will either choose a Medigap plan, which that plan just fills in the gaps under A and B. So it keeps you on original Medicare, and then as you go in for services like under B, it's going to, most of the time it'll pay the 20% for you, things like that. Well, the other alternative that you can choose is what's called a Medicare Advantage plan. Like you said, it's Part C of Medicare, so it's still under the Medicare umbrella. But what it does is it's a contract between the government and a private insurance company. These plans are all regulated, so they have to be approved by the government. But that really then means that your Medicare is being offered and covered through that private company's plan.
Got it. So it really does kind of like replace the Medicare system of the government. And now it's like you have a single point, which is now the insurance company.
Right. Claims flow through the insurance company's plan now, not through original Medicare.
Right. And we have a great vlog on our website, go4oaks.com, that explains those differences between Medigap plans and Medicare Advantage plans. Go ahead and check that out. I think it's very informative and pretty short and concise and gives them a lot of pros and cons of both of those.
Yeah, I mean, there's a hot debate, when people are asking their friends about, well, which one to do. Some people love Medicare Advantage. Some people would not touch it with a 10-foot pole, and they're right into Medigap. So it's really important to know which one is right for you.
Right. So then why do doctors hate it? I mean, that's the thing of what you're saying. I mean, they're used to insurance companies. They're used to all these things. The government's not typically super nice and fun to work with. So what is it that doctors hate about it?
Well, one of the things that doctors don't like is extra work. They got into the system to provide medical care, to care for people's needs. So when they think you maybe need an MRI or something like that, they want to write the order and then you go, and then they just want to see what the results are. Well, when you do a Medicare Advantage plan, they're within that system and they're going to have to do some extra work many times by maybe like a prior authorization. That's the key thing that'll big complaints. If you look that up on the internet right now, prior authorizations and Medicare Advantage, that's a big issue that the government's trying to deal with because the doctors then have to get more involved in explaining why it's medically necessary for you to do maybe a more expensive test than what the insurance company might want you to do.
Right.
And so when the doctors have to do that work, more paperwork, it costs them more money. And so they get really, really upset when dealing with the insurance companies, particularly when it comes to prior authorizations.
And what is it the reason why they have those prior authorizations? I mean, is it so they don't have to spend as much? Is it just because they like paperwork? I mean, what's the advantage to the insurance company for that?
There's always two sides to the story.
Right.
An insurance company would say, we don't want you to overutilize the system. We want you to only do what's necessary in order to provide what the doctor needs to diagnose something. So, but with that comes a cost containment issue that the insurance companies are going to try to keep their costs down. So there's a friction there because they may want to question why the doctor's wanting to do something when they think maybe you should go a different direction.
Yeah.
And so they would say, well, we're just trying to make sure that you're not overutilizing the system. But the doctors say, why are you getting in my business with my patient?
Right.
I know what's best for them. And that's where the struggle and they knock heads.
The main thing. What else? What are some of the other reasons why doctors hate it?
Well, so Medicare Advantage plans most of them are network-based plans. And so if you remember like an HMO or a PPO, is your doctor in the plan is what most people think of it. Well, the reason a doctor's in or out of a plan is all about how much the insurance company is willing to pay for their services.
Right.
Well, if you've been in insurance very long, you will recognize that sometimes in the mailbox you get a letter that the doctor says, we don't like your insurance company anymore. We're out. So sorry,
Right.
we don't accept it. Well, that's the fight that the insurance company and the doctor groups and the doctor's offices are always having. Doctors want to be reimbursed more. They want more money for the services they're providing. Obviously, the insurance company's not wanting to give a dime more than they have to, but they need doctors in their network. So there's a struggle, a tension between doctors having to fight to get paid more, or they're dropped or they drop the insurance company. Now, remember, when you have a lot of patients that maybe take a certain plan, there's a lot of pressure on a doctor's office to stay in that network because
They don't want to lose clients.
They don't want to lose clients. And the insurance company is the same way. So they will send rival letters. But again, the networks also are something that the doctors don't like because it just seems to be a fight year in and year out.
Yeah, right. So we got prior authorizations, network contracting, and negotiations. What else?
I'd say one of the last things, the kind of up there, the top three, so we've mentioned two. I would say the third one is probably sometimes payment delays. Now, it's going to vary between the insurance company, but again, it's just the more paperwork, the things that are involved in justifying and making sure that you're doing all the steps for a doctor to get paid. So they would complain about payment delays.
Okay.
That sometimes it's just not worth being in the network with a certain company because they're just making it so hard to get paid. So it's not just a network issue at that point. They've already agreed to the price that they're going to get paid. The doctor gets paid for their services. But then when they have to fight and do like all this paperwork in order to actually get the check, well, that's another thing that really irks doctors.
Another layer. No, that totally makes sense. And so obviously, though, some people, and we're talking about probably half the country,
half
the country now is on a Medicare Advantage plan that is Medicare eligible. So, what is it that's enticing them? Even though I hear it all the time, my doctor hates this, so I don't even want to entertain it. But obviously, some people do entertain it. Over half the Medicare eligible beneficiaries. So, what is it that does draw in those folks?
Right. And I will say, because over half the country, by 2030, they're estimating that 60% of Medicare beneficiaries of seniors will be in Medicare Advantage.
Wow.
So it is a growing trend.
Yeah.
And so like it or not, you're wondering, well, are any doctors in the network? Well, yes, when over half the country is, you can find a lot of doctors do reluctantly maybe go into and accept a lot of Medicare Advantage plans. So don't think that you don't have doctor choice within Medicare Advantage, because you do, because there's so many people that are in it. So, well, why are the people in it? So what you're asking.
Yeah.
So I would say one of the reasons is the benefits. So for example, remember, Part D prescriptions aren't covered under A and B. When it comes to dental insurance, vision insurance, there's a lot of things that Medicare doesn't cover, but that the government will allow a Medicare Advantage plan to offer in addition to just the normal hospital and medical benefits. So for some people, that is a huge thing that they need. I mean, dental, it's always a fight in the Congress about whether to add dental coverage to Medicare, but like it or not, it's not there.
Right.
So having a dental insurance plan that helps with crowns, root canals is something that is really important for someone who has those issues and may not have the money to be able to have that coverage.
Right.
So that would be number one. I'd say number two are most Medicare Advantage plans, depending upon where you are, have little to no premium. right? So if you're on a budget or you
Mhm.
just don't want to spend any more money,
Those
like on
on
a
a fixed
Medigap
income.
plan and
Yeah.
all that, you can get all of your benefits lumped into a Medicare Advantage plan and really not pay as much. You might even have a Part B premium give back. There's a lot of things that might even lower the cost
Mm.
from where you are now. So that's really, really important for many people that don't have the extra
Well,
money.
so many seniors are on a fixed income. I mean,
Right.
that's how it is. They just have their Social Security, or they have a little bit of savings in Social Security. So that budget component is a really, really important issue.
Right, because remember the other alternative we talked about, Medigap, there's an additional premium on top of the Part B. Then you have to get a drug plan. Those drug plan premiums have been escalating over the years.
Yeah, we're going to be talking about that in our news section.
Yeah, so I mean, you just have to know that many people, Medicare Advantage plans is a lifesaver.
Yeah.
And then finally, I think people like Medicare Advantage plans because they're like the plans that they've had maybe at their job whenever they were working.
Closer to an employer plan.
PPOs, HMOs, they're not unfamiliar to people. And so I think there's a lot of just people understand those plans, they make sense, and so they like them.
Well, that's awesome. And I'm glad that we were able to kind of unpack that a little bit and get why into some people love it and why doctors are not fans.
Yeah, so just be prepared if you're getting into Medicare and you ask your doctor, well, what do you think? Most likely or not, they'll say stay away from Medicare Advantage. And you know what? That may be what you need to do depending upon how you want your
situation.
care to be.
Right.
But the point is, don't always, the doctor has their opinion, your friends have your opinion. So just let us know.
Yeah,
and we
or
can
talk
go
to
through
some
all of it with you.
independent agent and go through your options.
Right.
Make sure you find someone that offers both sides of that coin so that you're getting a full view of all the options.
That's
for
right.
Sure, for sure. All right, well, that brings us into story time. Jamon, what do you have for us as story times go?
Well, just speaking of Medicare Advantage, I had a lady who was on a plan and really needed hearing coverage. And, people don't know that that type of coverage, getting hearing aids, is not something that Medicare is going to help with. Some Medicare Advantage plans don't do very well with that. Other ones do. So I was able to help her find a plan that really offered her a really nice allowance to be able to go get hearing aids.
Oh, wow.
That she otherwise couldn't afford. And so, again, it's very specific. These plans, options are very specific to the individual. And sometimes one plan that you've had before doesn't offer what you're needing now.
No.
So it's always good to have a review,
especially
just to see if you're not leave. You just don't want to leave any money on the
and
table.
you think about it. I mean, when you're 65, you have certain ailments, and when you're 69, you might have different ailments. You need to definitely get an annual review and make sure that you're on the right plan each year.
That's right.
Awesome. Well, the quote of the day is cherish your yesterdays, dream your tomorrows, and live your todays. I really like that one because I think it goes along with our theme. And just like the lady with the hearing aids, it's improving her quality of life. And that's why we love to do what we do, because we're actually helping people cherish your yesterdays, dream your tomorrows, and
live your
todays. Exactly. Awesome. All right. Well, that brings us into our news and deadlines. So what do you have for us today?
Well, just, we have a blog on the Inflation Reduction Act. Remember, there's just upcoming changes in 2025. They're putting an out-of-pocket max of $2,000, which is going to help a lot of people. But I'm wondering what that's going to do to premiums.
I don't think the insurance companies are going to love that.
So there's some give and take there.
Yes, so that's great. Thanks for that, for those tidbits. All right, well, that concludes today's podcast, Medicare GPS, navigating you step by step through your Medicare journey. We are super excited. Next podcast, we'll be going over Medicare and working past 65.
There's a lot of things you have to watch out for, and people are always wondering, what do I need to do? Well, you may or may not need to do something, just depends. So watch the podcast.
And yeah, watch the podcast to avoid the minefield. For sure. Well, that wraps us up. We're so glad you joined us. Make sure to like and subscribe, and we'll see you next time.